You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, autoimmune disease, what you could do to turn it around. With us, we have somebody that has her own personal story that reversed her autoimmune disease and now is living a healthy and vibrant life. She's a holistic health coach, Marcie Peters. Marcie, welcome to the program.
Thank you so much, Randy.
Now, I know your age. I almost said you look half your age, but you look at least 10 years, legitimately 10 years younger.
Thank you.
Than your age, so good for you. But for people that don't know you, tell me a little bit about your background and some of the projects you're working on.
Yeah, no problem. So I became passionate about health based on a 16-year chronic health struggle. Basically, I got sick in my early 20s, and the doctors didn't know what was wrong with me. It was very debilitating.
Like, what were your symptoms?
So I couldn't get out of bed. I was so tired, and
Wow.
I wasn't sleeping. As tired as I was, I couldn't sleep. My body just hurt all over. It just ached as if you're coming down with the flu, except for that feeling never left. It was just always there. And my stomach hurt all the time. I had headaches and migraines
What did
and
traditional
arthritis.
doctors diagnose you with? Depression?
They basically first said it's all in your head. Then it was depression. They treated me with antidepressants and muscle relaxants and kind of discounted me and basically said, okay, well, you have some symptoms. You can just manage those and that's it. We can't find anything wrong with you. Your blood work came back normal. And eventually they said it's fibromyalgia and chronic fatigue syndrome. And that is a diagnosis, but it doesn't really say what the underlying root problem is.
So what was it? Give us a recap of what turned out to be your issue.
Well, a bacterial infection called Lyme disease, which comes from a tick bite, and it actually causes, it's the #1 cause of arthritis, which I just found out. And it also causes digestive issues, headaches, migraines, pain, fatigue, everything that, I had been dealing with.
So you missed out on about what, 10 years, 15 years of your life?
Feeling pretty miserable? 15, feeling really, really horrible.
So today now you feel good?
I feel great.
You feel like what people say, I feel great.
I really do. I really feel great.
So you turned it around, and that's the topic of this short interview, which is you turned it all around. I don't want to put words in your mouth because you told me your story already.
Yeah.
You turned it around through nutrition.
Yeah. Through changing
an elimination diet.
Yeah, through changing my diet. Okay, so basically I got rid of a lot of things in my diet. For me, gluten, dairy, eggs, and a lot of the grains are an issue. Also, I do not eat artificial sweeteners or colors. Sugar can be an issue. I really limit that. So yeah, just changing that.
How soon did
and it
you
took
feel
about
better?
a year. I just want to tell you,
Oh, really? Okay.
it takes some time. I mean, right away within a few weeks, I noticed a lot of the swelling, the systemic swelling and the joint swelling had gone down, which was great. But really, it's taken over a year to get to this point, and you have to be really consistent with it.
So do you believe your body is slowly, like in a transition, healing itself?
It is healing. It's healed so much, and it continues to heal, and I know it's just going to get better and better because there was a leaky gut situation. There was intestinal permeability, and so things were coming into the bloodstream and getting out, and they shouldn't have been, and that was causing all sorts of autoimmune situations.
Do you ever run into people that knew the old Marcie that say, what have you done? You're different.
Well,
do you still look the same, or do you even look different?
I look the same, and I'll tell you one thing that's secret about me. I was so ashamed about having poor health and feeling badly all the time. I would just stay in, unless for the rare occasions that I was feeling up to going out, and then I'd take care of looking good. I didn't look that much different, but I think, yeah, there is an inner vibrancy that comes across much differently, even though I don't look that much different. I'm a little slimmer,
But back to my original question that you refused to answer. No, I'm joking. I said, do people ever come up to you and say, what have you done? You're different. You act different. Has anybody noticed that, or did you put on a show when you were out and about?
I was trying to cover up feeling badly, but I actually have had people more recently say, wow, you're just so shiny, and there's something, I can't put my finger on it.
Good. Yeah. So you believe the second half of your life is going to be the best half of your life?
Oh, yeah. It's so much better from here on out. And, at first I really looked at it as deprivation, right? Like I can't have this whole long list of things. And after a while, it's like, no, those things are poison to me. They're toxic. And so I really feel so much better not having them that it's absolutely worth it. I don't miss it at all.
Because a lot of people, they want to feel better, but they're not willing to make a bit of a sacrifice.
Right.
No gluten, no dairy. And they say, well, what else am I going to eat? Don't you hear that all the time?
I hear that all the time. And
they say, what do you leave? I mean, how do you live?
That's a scarcity mentality, and you really have to look at everything else you can eat. There's a whole huge list. So I have a pretty long list of things I don't eat, but I have a huge list of things I can have, and it's delicious and
so you can eat like
natural.
Do you eat red meat?
I do.
So you could eat red meat,
Yeah.
like lean meats,
organic,
and vegetables.
grass-fed, pasture-raised, ideally, you know, for the most part. Yeah, and vegetables, all sorts of vegetables. I eat fruit. You know, I have nuts and seeds and berries. You know, there's still so much.
And okay, good. And so who do you want to help the most? Because you're a holistic health coach.
Yeah.
Who do you, I mean, do you have a certain kind of like person that you say, boy, I'd love to
I really
help these
focus
women?
on people who have been struggling like I have, people with chronic, debilitating illness, and I can work hand in hand with their doctor and get all the tests, but help them really with the food part of it, because that's not something a lot of doctors really help with.
So you work with them meal planning, supplements.
Absolutely.
So you give recommendations for everything.
And so many of these symptoms, the fatigue, the pain, the joint pain, the headaches, the migraines, the digestive issues, will just naturally go, the weight, you know, will just naturally fall off if you're not eating the things that are causing problems for you.
Okay, good. I want to thank you for coming on the show. Very interesting. Good for you.
Thank you.
Congratulations. You've been watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.